July, a viral video pushed the immigration debate even further into public view. Clips of the confrontation spread rapidly online, fueling outrage among immigrant rights groups and raising new questions about the limits of federal authority inside medical facilities. To understand how ICE agents walked back into hospitals and courthouses in 2025, we need to rewind to January. On January 20th, Acting DHS Secretary Benjamin C. Huffman signed off on a quiet but powerful decision. The 2021 Protected Areas Policy was no more. Just 11 days later, on January 31st, the internal directive made it official. Enforcement rules had changed. According to DHS, the old rules caused operational confusion. Now, agents were told to rely on common sense and professional judgment. But what exactly was being torn down? Back in October 2021, DHS Secretary Alejandro Mayorkas issued a sweeping memo that created safe zones, places where enforcement wasn't supposed to reach. Schools, hospitals, churches, childcare centers, even food banks and disaster relief sites. For years, those places acted like a shield. But in 2025, with one stroke of a pen, that shield was gone. And suddenly, the spaces many thought were untouchable were no longer safe. ICE describes the 287G program as a way for state and local law enforcement to act as partners in federal immigration enforcement. These agreements, which differ from county to county, give sheriffs and deputies the authority to screen, detain, and hand over immigrants directly to ICE. By 2025, several counties in Texas and Florida were already operating under active 287G agreements, effectively expanding ICE's reach deep into local communities. Texas Governor Greg Abbott not only embraced the program, he doubled down on it. In January, he took to Twitter to announce the deployment of Texas Tactical Border Force teams, declaring they would work alongside our federal partners to enforce immigration laws throughout the state. Texas intended to be the tip of the spear in nationwide immigration crackdowns, but critics quickly pushed back. Immigrant rights advocates and several Democratic lawmakers in Texas condemned the move, warning it would escalate fear in local communities. They argue that these operations cross legal boundaries, intruding into spaces once considered untouchable. Nora Phillips, an immigration attorney and co-founder of Al Otro Lado, told the Los Angeles Times that courthouse arrests don't just intimidate, they sabotage justice itself. In a June 2025 interview with Wired, ICE spokesperson Michael Alvarez defended the arrests, insisting they only happen when necessary for public safety, and that many viral incidents are simply being taken out of context. Headlines now point to ICE gaining access to medical care data. That means information once thought private, your hospital visits, your treatment records, could potentially become part of an enforcement dragnet.
ICE will be able to access the personal data of the nation's 79 million Medicaid enrollees. This is according to an agreement signed this week between Medicare and the Department of Homeland Security. The information, including home addresses and ethnicity, will allow ICE to track down undocumented immigrants. California Attorney General Rob Bonta says he's deeply disturbed by the administration's actions and says, quote, "We are moving quickly to secure a court order blocking the sharing of this data for immigration enforcement. It's unclear if Homeland Security has accessed the information yet."
At St. John's Regional Medical Center in Oxnard, California, video from July captures a moment few thought they'd ever see again. ICE agents walking through hospital doors as staff demand answers. Outside, protesters form a human barrier, trying desperately to stop the operation. Just days later in New York City, another scene unfolded. On July 25th, a man from West Africa walked out of immigration court, his asylum denied. Within hours, he was taken into custody for expedited removal. Due process ended at the courtroom door, and in Tucson, Arizona, a Guatemalan woman who had just given birth on U.S. soil is now detained alongside her newborn. Border Patrol agents say they apprehended her while she was still 8 months pregnant.
I have some big news right now, but a Cincinnati Children's Hospital chaplain was detained by ICE. So I'm standing here trying to wrap my head around what just happened, but according to WLT5, which is a news source, Eamon Solomon, which is a chaplain, and compassionate presence at Cincinnati Children's Hospital was detained by ICE during what was supposed to be a routine check-in. He's the man who fled Egypt about a decade ago, and he was granted asylum. He built a life here. He guided families through their darkest moments, and then he had his status revoked in December for reasons that no one really can explain. But he arrived at the Homeland Security office around 9 a.m. on Wednesday. He had a usual interview. Instead, after 3 hours of questioning under the presence of ICE and even FBI agents, he was arrested and taken to Butler County Jail. And it wasn't just his colleagues who were stunned. Community leaders, interfaith allies, state lawmakers, they highlighted that he has no criminal record, that he's a devoted husband and father, and he believes that he faces a certain deportation back to Egypt after being detained by ICE.
I'm gonna go ahead and record this for my safety because you're being aggressive towards me. I need you to leave me alone and stop staring at me. I'm asking you to leave me. I'm trying to eat my dinner. I don't need you to argue with me. I need you, sir, to respect my privacy and leave me alone. I don't need to take orders from you. You're not my boss. Your colleague is asking you to calm down. I'm asking you to calm down. I need you to calm down and stop harassing me. Leave me alone and stop staring at me. You're making me uncomfortable. That's good. You want the people in the hospital lobby to be uncomfortable with you here. What was that?
You have no business.
I have no business to be here?
So you get paid for this?
I'm getting paid for this? That's some kind of conspiracy theory. I'm a concerned community member who's holding space for my family. So you need to stop harassing me, or else I'm going to send this to the news.
We don't need to be worrying about ICE agents roaming around or sitting intimidating our patients. They're here to heal. Dignity, health, common spirit. Your nurses want to know what the reasons are for this happening. We want ICE out of our hospitals and their designated security people just waiting like vultures to pick up hardworking people that contribute to our community.
I live in Los Angeles. Tell me why. I have a doctor's appointment right now at 3. It's 2:35 on my Uber. And I get 3 different calls from 3 medical staff and doctors informing me that ICE is gonna be there, like at a hospital. That is crazy.
We captured the moment 2 men went from migrants
Do not approach interpreters.
to detainees. It happened last week at Dallas Immigration Court when nearly a dozen people showed up to have their asylum cases heard. Their cases were dismissed by the judge, and when they walked out of the courtroom, plainclothes federal agents were waiting to take them into custody.
A man leaving a federal courtroom in San Diego last month telling ICE agents that his case was continued, not dismissed, allowing him to stay in the country. But seconds later,
Excuse me.
Hey, could you guys back up?
immigration experts say the videos taken by volunteers monitoring federal agents show a disturbing trend we're seeing at federal courthouses across the nation.
Outside a Bay Area immigration court, ICE agents arrested an individual as people nearby attempted to block the vehicle from leaving.
How you doing?
Yeah, good.
How old are you?
Huh?
How old are you?
I'm 24.
24? Where you just came out? Where you live at?
It's right here.
What's your address?
Wait for what?
What is your address? Let me see your ID. Since you don't want to talk, let me see your ID.
I'm confused though for what? I'm literally going to work.
I know. But what's your address?
I'll show you.
Have a nice day.
Yeah, all right.
In Los Angeles, California, staff at St. John's Community Health reported that patient visits dropped after ICE entered the facility. The organization estimates that 30% of undocumented patients have recently missed or canceled appointments due to fear. One longtime patient, who has lived in Los Angeles for 25 years, shared she is now afraid to go to the hospital. Following the rollback of DHS guidance, ICE has resumed operations in hospitals, courthouses, and other public institutions. Legal questions about the scope of enforcement authority in these settings are currently under review.